Welcome to the CPACE Podcast, produced by the University of Pittsburgh's Computational Pathology and AI Center of Excellence. I'm your host, Jordan Gass-Pooré, a science reporter covering the integration of artificial intelligence into pathology and laboratory medicine. In this series, we'll explore how AI advancements and pioneering research in digital pathology are not only shaping the future of healthcare and diagnostic excellence, but also fostering new opportunities for collaboration, linking researchers, clinicians, and healthcare companies. Welcome back to the CPACE Podcast. I'm Jordan Gass-Pooré, your host, and today we're going to speak with Jana Lipkova, assistant professor at the University of California, Irvine School of Medicine, within the Department of Pathology and Department of Biomedical Engineering. Jana's primary research focus lies at the intersection of technology, innovation, and medicine. Jana, to get us started, would you like to introduce yourself and tell us a little bit about how you became interested in health, AI, and pathology?
Hi, Jordan. Thank you for the invitation. I'm really happy to be here. So I'm actually a mathematician by training, but then I did PhD in computer science with focus on radiology. And after that, I did my postdoc in AI for pathology at Harvard Medical School in the lab of Faisal Mahmood, which was probably one of the best decisions in my life because it turns out to be one of the best places in the world to train for AI and pathology. And now I serve as assistant professor at UCI.
So, compared to advances in pathology that were exciting to you when you started your studies, what would you say is new and exciting about the field today for brand new students?
Oh, no, there are a lot of stuff. So when I started, I was actually the first postdoc in the lab, and AI and pathology was just started. So I started in 2019, just before the COVID. No, in 2020, just before COVID. And we were just looking how we can apply AI in pathology in the first place. So it was like a lot of exploration, just the basic question, can we detect the diseases? How we can handle this data? Well, what we have now, it's really outstanding. We have this multimodal model, foundational models. It's completely different direction. And when I started, there were like maybe 2 or 3 labs exploring pathology, and now we have companies, and it's really vibrant environment. So for the student, I just think it's exciting to be here, and like you have so many possibilities now, so many tools that you can use instead of starting from the scratch. So yeah, we want more students, so join us.
Speaking about advancements, how fast is the field of pathology advancing? And what trends are you seeing?
Well, I think we see some trends how it's going to evolve, but there is a lot of innovation, and it's going so quickly. Like when I was advertising for my faculty jobs, the stuff I was proposing are already outdated, right? So it's really quick. But I think there is a lot of focus on making the foundational models, making multimodal approaches to really focus on specific medical questions. And I think at the end, we may have some maybe generalized AI that's going to bring everything together and have really like assisting tools for pathology. So I think where we are converging is closer to the clinical practice rather than having these models that were developed somewhere in isolated lab to look at 10 patients. And now we're really going for the practice and clinical use.
All right, getting back to you and your lab, we'd be curious to hear more about your work at the University of Irvine and about your lab. Could you tell us about your lab's focus?
So we are located in the pathology department directly at the School of Medicine, and we're also affiliated with the School of Biomedical Engineering. So we are combining the technical with the medical applications. And the lab focuses on development of AI methods, mainly for diagnosis and prognosis using histopathology data, but we're also interested into integration of pathology with other modalities to build multimodal models and better understand the patient-specific conditions. And we look at both like development of the AI methods, but also for application of existing AI methods with the aim of answering specific clinical questions.
I forgot to ask, but your lab's website mentions Octopath research. And that research revolves around utilizing deep learning methods and medical images to develop strategies for objective diagnosis, prognosis, biomarker discovery, and clinical assistance. This includes the development of AI methods for automated and objective diagnosis in histology. Could you unpack Octopath for us? It sounds like a new industry term.
Okay, now this is the name of my lab. This was a lot of invention. But the idea was like the path stands for the pathology, and the octo, it's like resemblance with the octopus because we have hands is multiple pods of data and we try to integrate it together. And then I wanted to have a cute logo with octopus.
Looking through the papers that you've collaborated on, I see one on Artificial Intelligence for Multimodal Data Integration in Oncology. Can you tell us about this one and the different types of data that your lab is interested in?
So for us, the central modality is pathology because we are in the Department of Pathology and we love pathology. But then when you want to start answering questions about the survival, treatment response predictions, the pathology may not always be sufficient to try to see the disparities across patients. So we are starting to integrate genomics data, radiology, patient records, basically everything that makes sense to better understand what's happening with the patient. And now with the AI, we have this tool how we can integrate these different modalities and bring it together in one unified pipeline. So this is where this multimodal motivation comes.
As you work with new types of data, can you tell us, are these new types difficult to access and understand?
Access of the data is always an issue, but usually we work with like clinical experts that help us to understand. Like, I mean, when I work with the genomics data, even with the new pathology diseases, I need to have a pathologist to help me understand what we are looking at. But when we speak about the multimodal data, the biggest challenges is to build a data set where we have match information for all the patients. Like when you have for all the patients the same modalities, because the data in medicines are really diverse. They're gonna be we have different diagnostic protocols across centers, different assays. It's even difficult to link the patients within the one hospital across different departments. So we have a lot of missing data, and this is like one of the projects we are quite excited right now. So missing data and multimodal data integration is like really big questions.
So talking more about multimodal data and fairness, I'd like to reference another one of your papers. This one is on algorithm fairness in AI for medicine and healthcare. Can you tell us more about this work? And what kind of technical challenges are you seeing?
Definitely. So this is really big question that we should be looking, all of us should be looking at. So one of the issues is when we develop AI models, we often use public data or easily accessible data, and they often came from privileged patients. Like not everyone can afford to pay for the genomic testings. So many of the models that we develop are usually developed on white patients. There is very little underprivileged populations. And one of the concerns is these models underperform on an underprivileged population because they never met them. Another issue is if we have multimodal AI models that require expensive gene testing to make predictions, is the AI gonna even increase the disparities between the patients? So it's all the questions how we can train the models that are unified, that can address disease across all the patients, and how we can also use AI models to reduce the cost of healthcare so more patients can have access to the better treatment, better diagnostic. So it's a big question, but I think AI can also be a solution to the problem.
Has your experimentation with different types of data informed your thinking on other modalities and new ones to investigate? What new data types do you see on the horizon?
There is new modalities like the spatial transcriptomics, all the types of proteomics, all the multiplexings, which we often don't even know, or at least I don't know how they're related with the diseases. And there is where AI can be useful to explore these modalities, to search and discover patterns in the data and find their utility for the clinical settings. It's like a one direction. The other is to using AI to provide like synthetic biomarkers for the patients. Like we can generate some genomic information for the patient just from the histopathology images by looking at the correlation between tissue morphology and genetic changes. So if we can have like H&E slide for 50 cents, and then we run AI model to give us gene profiling for the patient that we need for like targeted therapy, it's gonna be fantastic, like low cost solution to enhance the equity and better treatment. So I think these are more two main directions: using AI to explore new modalities, and using AI to provide low cost or even non-invasive biomarkers to better screen for the patients.
So back to your lab. Can you expand on what your lab is working on connected with researching new data modalities?
We have a lot of projects. A part of it is like so one direction is we look at the multimodal data fusion and particularly how we can address these challenges of missing data. This is like very exciting. And they're like direction where we could use synthetic models to generate synthetic data, which is one way, and it's maybe meaningful for like tasks as diagnosis, disease detection. But I'm afraid it's not so relevant for prognostic models because there is no way to check that a synthetic image has the relevant prognostic information. And there is no way to know if this information is relevant under the multimodal context, right? If this patient has this mutation and these radiology images, how should the pathology image look like? So instead, we are looking at the ways we want to approach it basically as human would approach it. And we are trying to train this model in a way so they can learn to ignore the missing data and just pay attention to the available information for the given patient. And then in this way, you could be able to train models on larger cohorts with incomplete modalities and also apply the models in the hospitals who have different clinical practice on the data collection. Right? Maybe some patients don't collect all the MRI scans, or maybe don't sequence all the genes. So this is one very big direction. We have a lot of disease-specific models where we look at an organ transplant. I'm very excited about all the immune system and how we can learn across different organs, from heart to kidney. So we're trying to build a large cohort across all the possible transplants. And then more like a technical questions, how we can make models more safe, how we can make them better performant. And the questions are unlimited.
How did you become interested in the specific area of organ transplantation? This is an interesting specialization that we actually haven't covered on the podcast yet.
It's actually coincidence, because when I started my postdoc, I was looking the ways to projects I could work on. And now I was sitting in the lab, in the office of my advisor, and there was some heart biopsies from the patient that has heart transplant. And I didn't even know you can transplant, we can biopsy heart, right? I mean, it was so fascinating. And I tell him, I want to work on this. And he was like, no, do something. I was like, no, I want to do this. And then I really, really get attached. And it turns out to be a really, really nice project. And from then we started to be very excited. Also, a lot of people work on cancer, and it's exciting. But organ transplant is also very relevant, especially if we speak about immunotherapy and immune responses. The organ transplant is the next place to look for the immune information. I think it's all connected at the end.
So for student listeners, it sounds like you're giving them permission to get excited about specializations that maybe they hadn't thought of before, and to jump into studying them.
Oh, definitely. And it's really important to find relevant questions, because there are a lot of papers that look at improving segmentation, and it's great, but there are so many more relevant clinical questions that you can be looking at. So it's worth to spend the time to explore and speak with the clinicians to find something where you can really make a difference. So yeah, this is for the new students to explore.
You mentioned research questions. Can I put you on the spot and ask you to tell us, what research questions are you and the sector as a whole grappling with right now? What big questions are we, or should we, be asking ourselves in 2025?
I think one of the direct questions is how we can make AI models more efficient, how they can be more accurate and to be trained with less training data. And this is coming back to the foundational models, which became so popular in the last 2 years. And I think the way is we already have a lot of foundational models, but I think we're going to have more. And we're also, my lab, looking at the way how we can make better foundational models. And one way you can think about it, in pathology, we started with the patch level models, and then we have slide level foundational models. And I think the next direction is to have a patient level foundational models, which you have foundational models that integrate pathology data with other modalities to make this holistic patient representation. So this is one of the big questions. We also look at the way how to make foundational models specific for some domain. So in our case, we are looking at the organ transplant, how we can make better foundational model that's going to focus on the organ rejections, treatment response in organ transplant. So these are big directions.
In the lab, when you start to think about a project and questions that you want to study, how do you approach deciding what AI models to try or develop? There's so many models out there. How do you decide, and what criteria do you use?
That's a very good question. And I think we are still in the early phases of the foundational models, because there are a lot of models being developed and we don't really know how they compare. So actually, one paper that we are just working on now, we just try to benchmark all these models for specific tasks, like for the survival, treatment response predictions, and try to see which models are best for which task, and second, what can be the next direction for improving these models. So this is more like exploratory studies. Other ways is it's maybe inspired by the clinical questions. So if you are looking at a treatment response, maybe the multimodal foundational models that include histology, but also genomics, can be more suitable, or the whole slide level models, which are more context, can be relevant for the survival prediction. So it's more tailored for the specific problem you are looking at, but also you may want to compare a few of these models because they're coming so quickly now. So I think we really need these benchmarks that allows us to get insights on what is happening, what is the best solution for a given question.
When you're going through model documentation, thinking about transparency and explainability, what kind of information is on your checklist that you look for?
Yeah, that's a very big question, and we don't have answer to everything what's happening behind the hood of the model. But maybe like my checklist would be, so you would like to have a model that perform very well for the given task, model that was tested on external cohort. So this model is not overfitting, it can generalize to different data sets. It already tells you something about the model stability. And then we have all these like attention heat maps or ways that allows us to understand where the model is looking to make the diagnostic predictions. And you can bring this to your pathologies and you can discuss, is this meaningful for this task? We had cases where the model has really high performance and we did this interpretability and we saw the model was looking at a pen mark in the whole slide because the pathology segmented all the metastases. So, I mean, the model was correct, but, having a way to look where the model is looking, where the decision came from, it's really helpful.
That's great input. So next, in your lab, what's on your to-do checklist to tick off when you start a new project? What can you share for students?
It maybe depends on the problem, but I think the first step is to understand problem you're looking at. And this is always when we start new problem, we team up with the clinical experts from the field to help us understand like what is the pathology, what are we looking at, what are the pressing questions in the field. So just to understand the biology and make sure that we are developing right model for the right question. Also try to speak with them and see what is the way how they would like to use the model in a way so it helps with their work rather than disturb them. So once we answer these like generic questions about what is the purpose of this model, then we start looking at the solutions, how to address the specific question. And I think the best way is to start with the simple solution, just to get something to work, because it helps you to understand all the possible challenges you're going to be facing. And you don't want to start from the scratch. So look at the latest papers, like what people are using, which models have been developed, and just get smallest working solution, then discuss with pathologists. Is this meaningful? Is the model, like as we mentioned, the interpretability, is it looking at the right regions? And then how we can improve it to bring it to the clinical utility and to the patients.
This might be an unusual question, but what's something that a lot of us are generally not aware of connected with using other people's work? Maybe thinking about the subject of intellectual property and permission levels?
There are different levels, because usually when we publish paper, we make the model public because we want people to use it. And I still live in the academia world. I want to share with everyone. So using the public models that have been released, I think there is no issue with it. Of course, you want to give the credit where it's supposed to be. You want to acknowledge all the contributors, but using public models, it's really good. Then we have foundational models where the model, you don't really get so the model was trained on large amount of the private data, and you just get a pre-trained model with the weight. So it's not just taking the architecture, but the ready model. And I mean, again, using those models it's okay, but you don't have that much information about what exactly what data was used to develop the model. Maybe there are some like hidden information, but this is something one can be a bit careful. But I believe it's like a responsibility of the people. Once you release your model, you want people to use it. Otherwise, if your model relies on on your private data, you may maybe share the model architecture, but you keep the data private so people can maybe reproduce it or adjust the model to their specific settings. And often it's like you get inspired by someone's model, but you have to train it from the beginning to fit it for the specific problem you're looking at. So it's not like you take off-the-shelf model and you just apply it. You are collecting the data as the octopus from all the possible sources to build like your own model that best fit the needs that you have.
And okay, nerd out with me for 1 minute. Talking more about models. On a technical level, what kinds of challenges are you facing? I'd be curious to hear what should centers like Pitt's Computational Pathology and AI Center of Excellence be thinking about relative to technical challenges impacting research. What top challenges are on your list?
Exactly. So as these models are getting more complex, they're getting larger, and you need more GPUs. And this escalated so quickly over the last few years. So now you really need either clusters or really large computing centers to prepare the foundational models. So this may be a bit challenging for the new centers, but I think it's worth either to use cloud or to collaborate with other people, or using this pre-training model, right? So for those who don't need that much computational resources. The other is the data access, which is big questions on its own. How do you collect the data? How do you share it? How do you store your data? They are gigantic, right? How do you approach all this? So I think it's mainly the computational resources and the data access are the biggest challenges.
Thanks for all of your great input. For a reward, I'd like to talk about one of your favorite topics, and one that we rarely talk about, and that's mathematics. We noticed that prior to your PhD, you worked on mathematical modeling and high-performance computing in Zurich. For our listeners, What's new in mathematics and mathematically thinking? How should we approach starting a research project?
It's maybe when we start projects, maybe less mathematical, but more like a business model. Like, what is the question? What is the problem? Who are the stakeholders who's going to use it? But you would be surprised. There is a lot of AI happening in the world of mathematics because now people trying to use AI to solve partial differential equations and very difficult equations by training AI models to resolve this and make computations much, much faster. And also people are looking at a way how we can have mathematically inspired AI models. So we maybe know there are some constraints from the physics or from the biology and how we can bring it to the AI. So I feel it may be converging together to make not only better models, but more biology inspired, more physically constrained, more realistic, and maybe at the end we're going to have one better model.
We talked about your tech stack earlier and challenges, but can you walk us through how you iterate through a project mathematically once you decide what questions to tackle?
I think it's a lot of blackboard or now whiteboard drawing, like try to understand how to put the pieces together, what are the size of the vectors, size of the problems, make sure that the numbers, I mean, there is a little bit of math, like to make sure that the numbers make sense. Like if you're computing probability, do you really have probability? And things like that. And then more like statistical questions. Do I have a right power to answer these questions? Do I have enough data? So these are more like statistics and math problems that came in. Maybe more what I inherited from my math was like we were trying to develop mathematical models to improve treatment plans in radiology. And it's like how we can now combine this information with the AI models to optimize radiotherapy planning through so-called, we call it digital twins. So you combine mathematical model, AI tool, patient data, and use it to compare efficiency of the different treatment plans in computer environment to pick the best setup for the patient. That's again, the math, computer science, AI, everything is coming together.
Where do you see room for improvement on a student level around mathematics?
Depends on the student level. I think maybe because I have computer scientists that are transitioning to the medical sphere. So maybe for them, sometimes it's difficult to understand the medical questions, but I find they're like very excited and they want to learn, but try to read a little bit more about the disease to know why we are doing that, what are the questions we are looking at, that we just don't want to increase the performance score by 1%, but what does it mean for the patient, how this is going to be used after you have the model, how it's going to be used by the clinicians. That maybe these like bigger pictures, because sometimes students, they want to focus on their one equations and they may forget how to connect all the pieces together. But I like to speak with the student, like from the beginning, explain the problem, meet with the pathologists, with the clinicians, so they are part of all the project design. And then I think they start to think on their own, like how we can improve the models, what are the directions we can look at. So it's like really get a big picture first before you start looking at small pieces.
Switching subjects. What's difficult about bringing people together to work on projects? What can you tell us about the secret to establishing and managing good working relationships?
Should give you my secrets. No, I mean, of course, collaboration is really important, especially the more complex AI we have, the more interdisciplinary collaboration we need. So I have maybe two types of collaboration. One is more like building interdisciplinary team. So as I was mentioning before, so we make sure we look at the right clinical questions. And the other direction is about the data sharing. So maybe first about building this interdisciplinary team. I think important is to make sure that everyone feels as a part of the team and make sure that their voice is being heard. So you can have like a really real team and everyone feel as home and they're contributing. If you just go to your pathologist and ask them to share the data or segment thousands of images, they may not like you. But if you came together and you discuss, and if pathologists know they are part of the team, they are very excited to help you. And I find that this works very well. The data sharing is challenging. And I have like a mixed experiences across the US and Europe. So some centers in the US, they will tell you right away, there is no way the data is going to leave their hospital no matter what. While in Europe, I feel it's a little bit more flexible. But of course, you have different countries within the Europe. So we work with Switzerland, Turkey, which are not part of European Union. So the regulation are a bit different. Then we have Germany, Spain. They can have different rules. But I find people are very, if you again explain people what you are doing, why this is important, how this is going to benefit everyone, then people were very, very nice to collaborate. And maybe, okay, I'm not sure if I should be mentioning one of the secrets, but sometimes it's a bit hard to build a data transfer agreement. It takes time. And what we find, sometimes it's much easier to send people rather than data. So sometimes I send my students, they go to University of Europe, they get like research internships, they perform the project, the data never leave the hospitals, then they get back and we write paper together. So just like try to find the path of the least resistance to complete what you want.
So as we start to close our interview, on the podcast, we try to incorporate questions from students and from industry. For you today, we have a question from Sabri Mustafa Kaya, a PhD candidate and research assistant at the Chair of Media Technology, Technical University of Munich. Mustafa asks, how can we ensure the safety and reliability of AI methods in clinical applications, given that real-world settings are often more complex and diverse than the assumptions made during model development?
I mean, this is really, really important question because we have AI models that already have human level performance, or they're even better than humans, but we don't see those models in clinical practice, right? And one of the reasons is these models are developed and tested in kind of closed environment. Like, let's say you have a model that's gonna do subtyping for the non-small cell lung cancer. This model expects as an input non-small cell lung cancer data. It means someone have to pre-screen those data. And this is not very useful for the clinical settings. And the other issue is the models are usually developed for the most common cancer types, and it may work perfectly for 90% of the patient. But what will happen if there is a patient that is a rare disease or it has metastatic cancer? I mean, the model will still be forced to assign one of the diagnoses it was trained on, but it's not relevant. Even if you give a picture of cat, the model is still going to try to make some lung cancer diagnosis, right? And actually, this is kind of direction we are looking at because we would like to have a model that can abstain from making predictions when they are not sure about the diagnosis. Let's use the model to make perfect predictions when they know, and when the data are not suited for the task, I want the model to say, I don't know, let's ask the human. And interesting, we got inspired by the smartphones. Like you have your iPhone, you can scan your face, and the model is, the phone is going to unlock, right? Because it recognizes who you are. But the algorithm in the phone, it wasn't trained to recognize all the human faces in the world, right? It just knows how you look. It knows different shades of your face. I don't know, you before the coffee or after the coffee, right? And then it knows when it's you and when it's not you. And we're trying to bring the same to the pathology. Like we would like to have these AI models that can make the perfect diagnosis when they are sure, and when the data are different, they will just say, I don't know, let's ask the human. And it's going to be like the way how to partially address the safety, because if you can have a low quality of the data, you can have rare diseases, you can have adversarial attacks. And I want my model to say, I don't know, let's speak with the human. So this is one of the directions we're also looking at.
Given what you just said, let's say that Mustafa would like to collaborate with your lab. What's a good research project idea that you'd offer a student with interest in this area?
So I usually try to pick the projects so they fit the background or experience of the student, so they can contribute on their own. So if Mustafa would be interested in the safety of the models, it's going to be like looking at algorithms so we want to be like a model example, right? So we want to be inspired by the models from the practice. Let's see what people do to unlock your face with the smartphone, how we can mimic this environment with our pathology data, what do we need to collect to train such models, and how we can test it is like what are the different conditions. So we probably speak together, we define the model or like problems that's specific for the given patient, for the given student. Then we build a patient cohort that's going to fit the data and the problem, and then we will work on it together.
Thinking again about collaboration and partnership building, linking labs and centers like CPACE at Pitt, what's something that we ought to all be collaborating around? Like, what's something new that you can think of?
I actually think we should collaborate with patients. This is like a really underexplored path, because we know that AI has this potential to transform the healthcare, but it should be like a joint effort and we all should contribute. And there are a lot of patients that want to help and they don't mind to share the data. So for instance, there are some centers in Europe and they consider something like opt-out consent, where basically all the patient data with some level of anonymization can be used for AI research unless the patient opt out. A lot of patients are willing to help. So I think we can all work together, like bring patients together, bring the clinicians, and we are all trying to answer the same questions. How are we going to improve the healthcare? So we should work together.
That's a great takeaway for us to close our interview on. So as a reward and a thanks for all of your amazing input, how would you like to pitch your lab and share for students why they should consider joining you at the University of Irvine?
Because we have a nice logo. No, I would be very excited if we can work with more students. And as I mentioned, we try to find the problems that fit each specific student interest. This is one of the big advantages. Another, at Irvine, we are connected with more than 7 hospitals. So we are working with a lot of experts. We have access to a lot of data. We have a large amount of collaboration. Sometimes we send people overseas to perform the the analysis. So just like I'm interested in students that are really willing to learn and improve the field. And if you have such a student, then they can reach to me. We can do internship. We are hiring students at different levels. So I'm happy to speak with them.
That's a great pitch. And we do like your lab's octopus logo. I forgot to ask this earlier, but thinking about students again, and this time high school students, how are you and your colleagues engaging younger students? Pitt, for example, organized a workshop on medical image analysis using AI for high school students. Is there anything that you'd like to share relative to what you're doing?
We also have summer school for the AI that people can join, and there is also special like scholarship for the underrepresented students. We also do like a lot of seminars. We actually have a bi-weekly seminar focused on AI and pathology, but it's gonna restart in summer. So I can maybe reach and you can share with your student and they can join. And we basically invite experts from the field of AI pathology to speak about the latest research, and it's actually targeted for the students with the aim to learn and speak with these professors and learn about the latest research.
Jana, it's been such a pleasure speaking with you today. I've loved our conversation. Thanks again for joining us on the CPACE Podcast. From the University of Pittsburgh, thank you for joining us and for following the series.